So there were multiple studies on chemoimmunotherapy as well as on time-limited targeted combinations as venetoclax plus obinutuzumab, which have shown that patients are achieving undetectable MRD rates defined as either below the level of 10 to minus 4 or even deeper below the level of 10 to minus 6, that the progression-free survival outcome of those patients is excellently. However, we also know on the other hand that those patients who still have positive or detectable MRD, particularly when they have also more unfavorable karyotype as unmutated IGVH status, that those patients have a rather poor prognosis and obviously they have a very soon relapse. So therefore, I think the time has come now that we address the question, should these be patients who require further treatment, either by extension of the treatment or maybe even changing some types of administered drugs, by getting also undetectable MRD rates in those patients, initially still having detectable MRD rates.